For one thing, Dr. Duesberg says, and he's written, that AIDS is just a new name for an old disease. I've been working in immune deficiency diseases for 24 years. I've worked with some of the best people in the field. We know about susceptibility to disease, to secondary infections, to opportunistic diseases. And yet, when in 1979 and 1980, clinicians like myself who were trained in immune deficiency disease or infectious disease or in dermatology, who were familiar with what has been out there for the last or the preceding many years, began to see people with this new entity. It was so obviously a new entity that it did not take a genius to recognize that this was really a new disease. Let me finish.
Okay,
I think we have to say something to it, because you give me credit for something or attribute me something that I haven't said. It is not my disease, and it isn't even a disease, it's a syndrome. S in AIDS stands for a syndrome, a collection of diseases, and I haven't said it's new. The Centers for Disease Control has said these are old diseases, and the appearance of them is new. That may be new, but none of the diseases is new. I haven't said that, and the CDC hasn't said that. If it's your impression, that's a subjective impression, but that's not what I said, not the CDC.
Have you not written that AIDS is just an old disease in new clothing?
That's what the CDC specifically stipulates. The definition says old diseases in the presence of HIV are called AIDS. That's not me.
Okay. But AIDS is a new immune deficiency disease, which was not present in this country or in Africa.
Well, it is not a disease. It's a symptom of 30 previously known diseases.
There are two problems with the discussion so far. Firstly, the phrase AIDS. Dr. Duesberg is absolutely right. AIDS is something that we as physicians and scientists have concocted to suit our own purposes.
The USA Center for Disease Control's definition of AIDS states that men under 60 with Kaposi's sarcoma who have not been tested for HIV or whose tests are inconclusive have AIDS. Would Dr. Friedman Keen's patients with Kaposi's sarcoma and no HIV be defined as having AIDS?
At this particular time, the CDC, the Centers for Disease Control, and other scientists and epidemiologists around the country are reconsidering the definition of AIDS to perhaps change the definition not to include Kaposi's sarcoma as a definitive diagnosis.
All right. Dr. Siegel, you said you wouldn't be embarrassed by this and you'd like to respond. How do you explain that?
Not at all. First of all, it's very clear that the surveillance definition of AIDS is being confused with definitions of AIDS that have to do with pathogenesis and immunodeficiency. Certainly Kaposi's sarcoma has been around for long before the epidemic of HIV, and whether you equate the epidemic of HIV spread with the epidemic of AIDS, as I do, or you argue that it is only a marker, it's quite clear that that epidemic, with the exception of certain interesting isolated cases dating back as early as the 1950s, is a new epidemic. Now, if you confuse the case definition as a surveillance definition, which both the Centers for Disease Control and the World Health Organization, with somewhat different sets of definitions because of feasibility, basically, with a definition of disease at the immunologist's point of view, then what you are doing is confusing apples and oranges.
I really don't understand what you're saying, because fundamentally, if you can have full-blown AIDS without HIV, HIV cannot possibly be causing AIDS.
Well, that's
now,
a circular argument, because if you say that Moritz Kaposi's first case of Kaposi's sarcoma had AIDS, then you are wrong. That fits the surveillance definition for AIDS, but it certainly
But why do you have to have a surveillance definition in medicine?
You need a surveillance definition.
What is a surveillance definition?
Most infectious agents can slip into the immune systems of different people depending on the severity of immunity. But the multitude of infections that we're seeing in HIV patients, the presentation, we have never seen tuberculosis as it occurs in HIV patients. We have never seen cryptococcosis as it occurs in these patients. We have never seen cryptosporidiosis before the AIDS epidemic, really, in the presentations. So the definition fit nicely, and it allowed us then to pick patients who we said...
This is an artificial
construct. It was an artificial construct.
This is an artificial construct,
Why
and
do
I'll
you
tell
say
you why.
that?
It was very artificial.
I'll tell you why, because
you.
the first 41 cases of AIDS in this country, according to the New York Times, where the article was Rare Cancer Found in 41 Gay Men. It was in the movie Long Time Companion.
I remember that headline, actually.
Right,
yeah.
you remember that? If you read the article, and the next 5 articles in the New York Times, every single one of the first original cases of people with AIDS were heavy drug users. They happened to be gay, but they were all admitted heavy drug users.
And I want to add to that, because you say you'd never seen this syndrome, but only this year, in fact a few months ago, one of the leading science journals, I can't remember which one right now, explained that drug addicts in New York who were HIV negative were showing the exact same symptoms as full-blown AIDS.
No, that's not correct either.
Well, how about Jackie Onassis? Jackie Onassis died from non-Hodgkin's lymphoma and pneumonia. If she were gay, she would have been given a presumptive diagnosis of AIDS. They wouldn't have given her an HIV.
Only if she were HIV positive, these gentlemen are saying. Okay, yes, Dr.
But she would have died of AIDS-like illness.
Dr. Horton.
How pointless it is to talk about AIDS. What we want to know about is what's the cause of the progressive immunodeficiency that you see that is associated with HIV infection.
Very good.
Let's forget AIDS.